So Cindy's a 57-year-old who was having a wonderful time. It's a beautiful day, it's sunny, and so she goes for a boat ride with friends. They're in the boat, everyone's having a blast. The waves come and the boat kind of rises and falls with the wave. Everybody kind of rises in their seats and they fall back into their seat. When Cindy falls into her seat, though, she notices this excruciating pain. She looks around and she's the only one in pain. Later, she's diagnosed as having osteoporosis. My name is Dr. Arinola Dada. I help people who have concerns about their joint function and bone health preserve their joints and bones so that they can live an active life. So let's talk about osteoporosis. So what is osteoporosis? Osteoporosis is fragile bones. And if you've heard anything about osteoporosis, you're thinking, well, this happens more in women than men, and you are right. Osteoporosis is more likely to happen in women because once we women hit menopause, we lose estrogen, and estrogen is the most important component for women for bone density. For men, though, it's testosterone. And then you can ask, well, can men ever get osteoporosis? Yes, they can. There are lots of other factors other than just the hormones that affect bone density. For instance, genetics, medical conditions, some medications can all lead to low bone density. I want to tell you 5 things that you can do right now that can improve your bone density. So we'll start with calcium. Calcium, you can imagine you get that from dairy. People who are 20 to 50 years old should be taking at least 1,000 milligrams of calcium a day. If you're older than 50, you should be taking 1,200 milligrams per day. And you can ask, well, where do you get said calcium from? Well, you can get it just from supplements. You can get it from dairy, green leafy vegetables, canned tinned foods like tuna, salmon, all have additional calcium that would be helpful. Vitamin D, at a baseline, people should be getting at least 800 international units per day. But if they're vitamin deficient, then they probably require more. Exercise. This is divided into 2. There's just one, which is just the weight-bearing exercise. If you think about kind of your feet on the ground, so walking, running, hiking, and even a Zumba class can all improve your bone density just from that weight-bearing exercise. There are some other exercises, although are great from an aerobic and cardiovascular standpoint, such as swimming and cycling, they do not improve your bone density by the weight-bearing exercise. So just think about activities that involve your feet on the ground. The next thing is strengthening. As we get older and more mature, our reflexes are not as good, and we can improve our reflexes and stability by strengthening. So strengthening, my best analogy is if you think about grandma kind of falling down the stairs versus a basketballer falling down the stairs. So grandma falls down the stairs like kind of like a bowl of spaghetti, and a basketballer is able to stop his fall, grab onto the banister, and that's because he has good reflexes and he also has strong toned muscles. So we are never too old to strengthen our muscles. We're never too old to tone, and so we can tone even by yoga, Pilates, weights, even the smallest weights. You just do frequent reps of them, and that helps to tone the muscles and tendons. Other thing is get a bone density. Women over 50 should get a bone density. Men should get a bone density if they have a fragility fracture. And a fragility fracture is you fall from a standing position and you break a bone. Typically, you really would not break a bone, I guess, except if there's an accelerated injury where you slip and boom, you fall. But if you have a fall and the fracture is out of proportion to what would be expected, then it's time to get a bone density. And finally, talk to your doctor. If you're in the Seattle area, give us a call. I'm Dr. Arinola Dada, Overlake Arthritis Osteoporosis Center. Like us on Facebook, share this video if you think it's helpful or if you think anybody may benefit from it. Thank you for listening.